everyone, my name's Logan. Just to introduce myself a little bit, I work as a behavioral health nurse at Mount Nittany Medical Center, and I decided I wanted to do this teaching presentation on interpretation services because, as you can imagine, Mount Nittany Medical Center, of course, is right by Penn State University. We get a lot of diverse people that come into our area all the time to go to the school, to teach, to come visit their family who move into the area. It's just very large influx of people generally that come to the area, and they don't speak English as their primary language. Rather, they might speak their own native language. So typically for a lot of those students who didn't grow up here in the States, they speak English perhaps as their secondary language, and even then might not be entirely fluent in it. So it's not uncommon for us on our unit at least, and I know throughout the entire hospital as well, that we need to make sure that we as nurses and staff and providers notice that these patients have a language barrier and they need to be able to understand what their care means and how they can go about their aftercare and what just everything that we have to offer them in the community. There's a lot of things, of course, to discuss during their stay. So I just wanted to talk a bit about that, and because I feel it's important, and then sometimes it can go unnoticed, or it can kind of tend to be sometimes too more of a hassle, and sometimes it's just not thought of to get the interpretation services out and to do that for our patients. So I just want to bring a little bit of awareness about it. So we're going to just start off here by kind of just talking about the languages in America. I really thought it was an eye-opener when I started looking into all of this for this project. There are approximately 66.6 million U.S. citizens that speak a language aside from English at home. And so in total, that's more than 20% of the United States population. And you can see here this little map underneath with the color-coded states. So that map is representing the most commonly spoken language other than English or Spanish per state. So of course, being a bit biased, I of course look at Pennsylvania first and notice that Italian is the third most spoken language in that state. So it's kind of interesting. I think it really encompasses how diverse our country really is when you look at it that way. And then if you just look over at table 1, that is just, so it's listing the number of speakers of languages other than English in the United States. So you can see it starts with Navajo, and then it goes down to Spanish, so it works its way, like the least amount of people to the most amount of people at the bottom, and then at the end you can see it's at 66.6 million U.S. citizens that speak a language aside from English at home. So I just thought that was interesting to see how many people speak like Navajo, Persian, Japanese, Korean. It kind of just gives you an idea of that 66 million rather than just one big figure to break it down a bit. And then next, who is qualified as an interpreter? So interpreters are trained professionally and medically. They typically have a degree, and that's a bachelor's degree. It's the most common. But there are some certificate programs available. For either the certificate program or the bachelor's degree, you have to be able to speak two languages fluently. And then the job description per study.com for a medical interpreter is that they act as conduits between patients and medical professionals by listening to the professional and orally translating information into a patient's native language in layman's terms. So it's just important to recognize that there are interpreters and then there are translators. So that could be like somebody who is using sign language and then translating it orally for somebody else. An interpreter orally translates one person that's verbally communicating to another that's verbally communicating. Also, family members or friends are not an appropriate choice to provide interpretation. Family members and friends, they're just not always familiar with medical terms and procedures, so they're unqualified. And they could also present biased opinions about care, but we'll touch a little bit more on that later. So what are interpretation services? They're used to verbally convert tone of a spoken language, words, emotions of one language into another. They ensure that patients are being communicated with appropriately, according to their preferred language. And interpretation services are offered to individuals whose preferred language differs from those in which they are receiving care from. So I know in our admission assessments at Mount Nittany, we have to indicate which language is the preferred language of the patients to help determine if they need a interpretation service. So why are interpretation services important? So as we talked about, America is such a diverse country. The amount of languages spoken in America are increasing all of the time. Approximately 25 million Americans are unable to speak English well, and it's easy to see that these numbers are fairly concerning, especially so for the safety of patients and providers as well. When patients can't understand their care, it can result in a lack of health literacy. So just highlight that according to World Literacy Foundation, health literacy is measured as the degree to which an individual has the skills to comprehend and make informed choices based on the information given regarding their health. So there are many effects that take place on patients whenever they are not able to understand their health care. It's important because whenever they do understand and they are health literate, they're able to seek support. They're able to get outpatient services. When they come to the ED, they're able to recognize when they need to do that to get the help that they need. They're able to understand nutrition, medications. They know how to properly care for their body. They understand the risks and benefits, which we know are so important. When a medication is a modality or if it's a must. And then completion of paperwork. It's important that they understand what they're signing or agreeing to. And then they're able to organize healthcare appointments as well. So knowing who to see and when to see them. So again, there are 1,396,223 people that speak a language other than English at home just in Pennsylvania. Hopefully these people all receive health care. But as you can imagine, when someone's preferred language is not the same as the providers caring for them, it's so important to make sure they're receiving the information in a manner they can decipher. And that's why interpretation services are so important, so that they are health literate then and they can make all of their appointments and understand what their healthcare needs are. And then how do interpretation services affect patients? Interpretation services help ensure patients are being communicated with appropriately according to the preferred language, hence leading to better patient outcomes and solid comprehension of disease process and care. So not only is it important for patient safety that they're being communicated appropriately, but we as healthcare workers have to ensure they're receiving the best care possible. When interpretation services aren't used, it can really lead to poor patient outcomes, and ultimately it can lead to lawsuits as well. So, of course, the patient comes first, but we as healthcare workers have to protect ourselves as well so we can keep caring for our patients. So, that kind of puts us onto the next slide here. The risks of not using interpretation services. So, improper, and we're just going to go over a true story. So kind of, again, ties everything together for us, makes you realize how much interpretation services matter. So there was a 13-year-old girl. Her name was Griselda. She was brought into the ED in Phoenix, Arizona. She had two anxious parents. They rushed her into the emergency room. She was suffering from severe stomach pains. The parents only spoke Spanish, and the hospital staff spoke only English, and Griselda was often their translator, but she was of course too ill to explain her symptoms. She was given a pregnancy test, and she was diagnosed with gastritis, and then she was sent home. She was just given instructions to go home and to follow up with her PCP within 3 days. But sadly, Griselda's symptoms, they worsened, so the next day her parents took her to a doctor recommended by the hospital. Although accompanied by a 14-year-old bilingual friend who served as a translator, Griselda still didn't receive treatment for her symptoms. So she was sent home again. The family then returned to the ED again. Griselda was diagnosed finally with a ruptured appendix, and she died a few hours later from that. So it kind of just gives a great example of how much these services really matter and it makes it like if they would have just used interpretation services and done that, then they would have been okay, and they'd have been able to appropriately communicate what was wrong with Griselda, and then hopefully her life could have been saved at that point. So it does, I mean, that is a true story. It obviously it happens, and it's so sad that these things that could not happen and that could be avoided completely do. So there are different types of interpretation services. Typically, hospitals are to provide interpretation services to patients when they're needed. There are many different interpretation service companies that are used. I know Mount Nittany, we do have one that's hospital-wide, and it's pretty neat. They're on these iPads that you log into, and they're, of course, HIPAA compliant and everything, and then the interpreter sits there and everybody talks to one another. So some of these services include, like I said, video calls on a tablet, and then there's phone-based, so via a 3-way call, and then there's also on-site visits available in some places. So interpretation is live, and it always happens in real time. It can be an interpretation between spoken languages, and then, like I said, the translation, like translator services, would be for between spoken languages and sign language. So whether, I guess, your patient's speaking verbally in other languages or is using sign language as the main way of interpretation is very important. And then that's it for this slideshow. Next, you can see my references here for the information, and then also for the figure and the table as well.